Okay, guys, good afternoon, and it's good to talk to you again. Now it's another topic, which is I would talk to you guys about the histology of the digestive system. And of course, today we'll start with the first part. So, guys, you know from the previous lectures that the GI system can be divided into, I would say, alimentary tract or alimentary canal, and with the help of accessory digestive organs. So when you say digestive or alimentary canal, that means you talk about the mouth, pharynx, esophagus, the tract, the canal, including also the stomach, small and large intestine, at the all the way until we reach the rectum and anus. So that's the alimentary canal. But the accessory digestive organs, which they are important, and they include the tongue, salivary glands, gallbladder, and liver, plus the pancreas. But I would like guys to know that there is a general certain structural features are common in GI system. So especially when you talk about the GI tract, guys, and I would say the whole tube that you see here, this is a cross section of GI tract. I will not say from where now because this will be covered in the second part, but I would like to keep a couple of things in your mind that the tube of the GI system has, guys, four main layers. You have a mucosa, submucosa, and you have muscular layer and covered by outside by serosa. But let me show you here, guys. This is again a cross section through the I would say GI system, and you see the basic histological layers, the four layers starting from the mucosa. Well, guys, keep these things in your mind that we have four layers, mostly across the GI system. They are the same, except with a few exceptions. So the mucosa, guys, when you say mucosa, you have to remember three things. The first, more internal layer is the epithelium that lines this whole tube. And this epithelium supported by a lamina propria that you see here. And the lamina propria supported as well by a very thin, smooth muscle layer that known as muscularis mucosa that you see here. So let me just show you these parts, and I will talk more about these structures. Now, these structures, the three structures known as mucosa, or you can say mucous membrane, the same. Outside the mucosa, you have submucosa, this layer. Outside the submucosa, you have a muscular layer known as muscularis. Listen, guys, it's the muscularis, not muscularis mucosa. Muscularis mucosa is a small, thin layer of mucosa. Small, thin muscular layer of mucosa, but muscularis or muscularis, guys, is a muscular layer that covers the mucosa from outside, so the submucosa from outside. These two layers, and from outside they have the serosa. Back again, guys. Let me show you again. So, as I mentioned, the mucosa, guys, composed from the epithelium, and we'll talk about it, and supported by lamina propria. This lamina propria is a connective tissue. When you say lamina propria, you have to remember, guys, that this layer has vessels, nerves, and lymphatics. Simply, vessels, nerves, and lymphatics. And outside, you have the small thin muscular layer, small muscular mucosa, which separates the mucosa or mucous membrane from the submucosa, and for that reason it gives the mucosa the freedom, or relatively the freedom to move. Now look at the submucosa. It has also lymphatics, but mainly look at it here. It has a nerve plexus. This nerve plexus, guys, known as submucosal plexus. Look at it here. So this is the submucosal plexus, or it's known as plexus of Meissner. Plexus of Meissner. Now, outside the submucosa, guys, we have the muscular layer, as I mentioned, known as muscularis, and it's composed from two layers mainly. The inner circular, look at the direction of the fiber, and outer longitudinal layer, two layers. But between the two layers, look, this is the circular layer, and this is the outer longitudinal layer. In between, you have another nerve plexus shown here. Look at it. This is another nerve plexus, other than the submucosal plexus, between the two layers, and it's known as myenteric plexus, or plexus of Erbach, the scientist who discovered these plexuses. Now, somebody can say, okay, what's the difference between the plexus of Meissner or submucosal plexus and myenteric plexus? Well, guys, the plexus of Meissner, these controls the secretion, controls different secretions, right, into submucosa and mucosa. But the myenteric plexus, which is, from its location, you can conclude that it controls, because between the two layers of muscle, so it controls the contraction of these muscles and ultimately the movement and peristaltic movement of the GI tracts. So this is already covered. So let us start with the first part in the GI system, and what we mentioned previously, just a general common features shown in the along the GI tract. So guys, let us start with the mouth. This is the oral cavity, that, as you know, and listen guys, keep this in your mind. Stratified squamous epithelium. Well, you know that the squamous epithelium, it's the strongest epithelium in our body, and you know, it's stratified. That means more than one layer. It reaches up to 30 layers. We need that, guys, because this kind of tissue is for protection. This kind of tissue, guys, when it lines an cavity, it helps to protect it from abrasion, and usually it exists where the, especially if it's keratinized, where's the more erosion and friction there. So this stratified squamous epithelium can be, guys, keratinized, covered by a keratin, or partially just keratinized, or maybe it's not keratinized at all. It depends on its location. So, for example, where do you expect to see, where do you expect the more friction in your oral cavity? Well, guys, I think you can say yes, it's mainly in the gum or gingiva and in the hard palate. So these two locations, guys, covered by keratinized, of course, stratified squamous epithelium. Always we have to remember that we have stratified squamous epithelium. But this time, guys, you have to choose keratinized or not. So these regions, hard palate and gum, are exposed to more friction, so they will be keratinized, right? But of course, there are other regions that not exposed to that too much of friction, especially for food or so, relatively compared to hard palate and gum. Usually, guys, the soft palate, your cheeks, the oral vestibule, and the floor of your mouth, which is really smooth, and the pharynx in the back as well. So these structures, guys, covered by, yes, stratified squamous epithelium, but non-keratinized. We don't need that much of protection. So that was mainly in the oral cavity, but what about the lips? Let us take cross-section through the upper lip and look at it here on the right figure. So guys, the lip from outside, from here, absolutely it's the skin. So it's dermis and epidermis, right? And of course, you see, guys, here the hair follicle, of course, with sebaceous gland. So it's really a skin, normal skin, right? But internally, if you look to your lip internally, you will see that it's a stratified squamous epithelium, yes, but do you think it will be keratinized or not? Of course, the skin outside is keratinized, but from inside, we don't need that keratin. So it is non-keratinized stratified squamous. Furthermore, I think at the edge, guys, which is the red margin between the, this zone, guys, the transitional zone is known between the skin outside and the internal side of your lip, is the red vermilion zone. This known as red margin, right, or red zone. So here, guys, it says transitional location in which you transmitted gather from a skin which is keratinized to internal side of the lip which is non-keratinized. So usually this region, vermilion zone or red zone, is just partially keratinized. Well, one other, I would say, there are other characteristics for this zone, that it's highly innervated, in which if there is an ulcer there, you will get that, so much of pain because it's, as I mentioned, highly innervated. Plus, guys, this region has a lot of blood supply, in which if there is a decrease in the oxygen level, it clearly becomes pale, and you can't tell, of course. And of course, I don't think one time you see that your lip here, this margin, like gets sweating, or you find oily substances there or secretions, because this region is devoid of sweating gland and or sebaceous gland as well, or hair follicle even. So there is no hair follicle there, no sebaceous, no sweating gland, and but it's highly vascularized and innervated. So let us move a little bit internally, guys, inside the oral cavity. So what we have other than the lips, of course, guys, we have the tongue. So look at the tongue, and you know that the upper surface or the superior surface of the tongue is the dorsal surface, while the smooth lower surface of the tongue is the ventral surface. Anyway, which is easily, you can see that the lower surface or the ventral surface of the tongue is smooth and has no keratin, while the superior surface, guys, has a villi, something like villi protrusions here, which is the tongue papillae or lingual papillae. Of course, it's keratinized mainly. Well, look, guys, here in the tongue, you have lingual gland inside it. And of course, if you look to the lips, you will find also labial glands here. So these are minor salivary glands that continuously work 24 hours. These are examples of minor salivary glands, because we have major like parotid, submandibular, sublingual. Of course, we cannot ignore, and I think the lips we forgot to talk about the muscle here, skeletal muscle. Way back to the tongue, that's it's as you know, it's a muscle, as you see here, that covered by a mucous membrane, and we started with a mucous membrane, as I mentioned, on the dorsal surface and ventral surface, and internally, you know, from the gross anatomy, that it has, I would say, the intrinsic muscle fibers, which is, you know, arranged in different directions. You see, can be vertical, can be transverse, can be longitudinal, superior and inferior as well. So yes, this is the major structures in the tongue. So this is the covered. We mentioned that the ventral surface of the tongue is non-keratinized, composed to the dorsal one, which is keratinized. Now, yes, we noticed that there is a projections here, and we said that these are tongue or lingual papillae. What's the lingual papillae? Look, guys, I would like to remind you that this is mucosa and this is epithelium at the end of the day. And, you know, this epithelium supported by lamina propria that you see here. And you see the lamina propria invaginates the epithelium up, you see. So let us see which kind of structure these lingual papilla. Okay, here is the lingual papilla, regardless its type. So it's a little mucosal projection, guys, of course, by the lamina propria from inferiorly or below it. And it's, of course, stratified squamous epithelium. Now, how many types we have of this kind of projections of lingual papilla, and what the function of them? Yes, we have 4 types of these kinds of papillae. Well, the first one, which is really numerous in number and distributed across the anterior 2/3 of your tongue. Look at it here. It's like a thread. It's a filiform papillae. Filiform, it means a thread-like shape. So look at the keratin that covered them. So they are stratified squamous epithelium, keratinized stratified squamous, as you see, right? So they are conical in shape and like a thread, as I mentioned. Well, guys, they have no role in taste. They don't play any role in taste. But so what their function, their function is just to facilitate, like projections, to facilitate the movement of the food particles during chewing, of course. And in infants, بالأطفال يعني, they help them suckling the milk, of course, برضاعة يعني. And in animals also, which is very prominent, they help them in lacking as well. يلعقوا المي والأشياء. But there is no taste bud on them, so they have no role in taste. The second, let me show you the previous one, which is here, guys. Let us wait, because I have to show you the second type of papillae, which looks like the mushroom shape. This is the mushroom. So guys, look at it here. It's like a mushroom shape. And interestingly, this fungiform papillae is known as fungiform papillae, right? Also distributed along the anterior 2/3 of the tongue, but they are a few in number. And you can notice them, you can see them by the mirror. Why? Because they are very vascularized, and when you eat something chili, you will see that really they are like red. Um, uh, they are like red dots on your tongue. Look at the tongue here, guys. Look at the red papillae here. These guys are the fungiform papillae. They are few in numbers, yes, but you can discriminate them, you can identify them. So what about the rest of the papilla? These papilla distributed here. Yes, this is the previous type, which is the filiform papillae, right? Of course, guys, it's covered by stratified squamous epithelium, but listen, it's lightly keratinized compared to filiform. Look at the previous type, the filiform, it's highly keratinized. Look at the keratin here, but the fungiform papilla is lightly keratinized because, you know, it has a role and taste, because it has taste buds. Look at the taste buds. So it contains some taste buds and it helps in taste. So it doesn't it will not be helpful that if they have keratinized, so they are lightly keratinized. So not to say that much about the circumvallate papilla, but I think, guys, you know, if you look in the mirror, you would see some like protruded masses at the border between the anterior two-thirds of your tongue and posterior one-third. These are circumvallate papillae, the third type of papillae. They are not protruded up. They are usually not protruded above like this kind of fungiform. Usually they are embedded, as you see here. This is the circumvallate, and they create like a V shape anterior to the sulcus terminalis. And let us dig deep in that. You will see in this groove, guys, in the furrow, so or the crypt, or you can say it furrow. So on the lateral wall of this circumvallate papillae, this kind of papillae, you will see there are many taste buds on each side. These there's many taste buds, of course, help in the taste. In this kind of papillae, guys, it's interesting that they have a kind of serous gland, serous salivary glands here. Look at these glands. These are, guys, located just below the furrow, below this slit. Why? Because their serous secretion, which is like watery in contour, so they will wash out this crypt or this furrow and wash out the taste buds. So then the taste buds will be from these glands, okay? So when they wash out this crypt and the taste bud, then the next food, the next taste will be ready to be received by these clean taste buds. So these glands known as Van Ebner's serous gland, Van Ebner's serous gland. The last type, the fourth type of papillae, guys, which is not well developed in a human, but they are developed in rabbits, for example. Anyway, they located or they are ranked as several ribs shown here. They have a taste buds, stratified squamous epithelium covered, of course, and of course they're, I would say, located close to the end of sulcus terminalis. Here's another view, and they have taste buds known as foliate papillae. This is the fourth type. Okay, so this is repeated and repeated. So taste buds. Just what's the taste bud? So guys, look at the taste buds. If you take it and look at it under the microscope, you would see that composed from three types of cells. First of all, it exists, of course, in the tongue, in the epiglottis, soft palate, where the taste can be received, in the pharynx as well. And you know they are present in the circumvallate and fungiform and foliate as well, but not in filiform. Anyway, it's like onion shape with the شكل البصل and composed from T cells. Most importantly, the gustatory cells, pale in color as you see here. You can call it, of course, neuroepithelial taste cell because there's a nerve endings, as you see here, lodged there to carry the taste as a sensory nerve. So this is the gustatory cells. The gustatory cells or neuroepithelial cells, guys, supported by other cells. These cells are supporting cells, like this, this, and this. And finally, we need these cells, I mean the gustatory cells and supporting cells, to be replaced. So we need the stem cell there, original cells, to replace both of them when they are damaged for a reason or another. So these cells located at the base, so they are basal cells, right? Basal cells. So that was the oral cavity, tongue, lips, and different structures there. Let's move a little bit back, guys, to the pharynx. You have nasopharynx, oropharynx, and laryngopharynx. Well, guys, the nasopharynx will leave it to the respiratory system, but I will focus more on oropharynx and laryngopharynx related to the GI. In which, guys, as I mentioned earlier at the beginning of the lecture, yes, we have four major layers: mucosa, submucosa, muscularis, and adventitia. Adventitia, guys, can be adventitia or can be serosa. It depends. If you are under the diaphragm, that means in the abdominal cavity, that means you have peritoneum and serosa, right? But above the abdominal cavity, above the diaphragm, I mean, this is the diaphragm, for example. So above the diaphragm, there is no peritoneum. So there's no serosa, but we have loose connective tissue, which is known as adventitia, that connects, for example, the esophagus to the surrounding structures. But what, again, it doesn't matter adventitia or serosa, but the four major layers of pharynx, guys, will be mucosa, submucosa, muscularis, and the outer adventitia. So the mucosa, of course, guys, let's just start with the oropharynx. Look at it here. First of all, it's again and again stratified squamous epithelium. This epithelium, keratinized? No, it's not keratinized. It's non-keratinized. It cannot be keratinized in the pharynx, right? So it's non-keratinized. And of course, there is a mucus, I would say, gland located there to lubricate the pharynx. What else, guys, we have? We have just, this is the epithelium, yes, supported by lamina propria. Deep to lamina propria, we have, of course, you know that the mucosa composed from three layers. ثلاث أشياء حافظينهم: epithelium, lamina propria, muscularis, and mucosa. This is the thin layer of muscularis and mucosa. And the second layer will be submucosa. This is the submucosa with lymphatics and the glands. Deep to it, we have muscles here, which is, the muscularis, and of course, outside we have the adventitia that connects the pharynx to the surrounding structures. Well, laryngopharynx, similar to the oropharynx, not that much difference. And now, most importantly, yes, we finished the oral cavity, but let us shift to the other structures that they empty their secretions there. They are the salivary glands. Salivary glands is, guys, important for many reasons, including the exam, of course. So I would remind you that we have minor salivary glands and major salivary glands. You know the major salivary glands, and we covered them in gross anatomy, including parotid, submandibular, and sublingual. But the minor salivary glands, I think I show you two examples when I talked about the lips, labial glands. There was a gland and the minor glands in the lips that they lubricate the internal cells of the or the mucous membrane of the internal cells of the lip. 24 hours they are working, right? And I showed you the lingual glands inside the tongue. Anyway, the minor glands in general, they have a role in the lubricating and keep the mucosa moist. Well, how can I remember them? There is an easy way, LP. So LP, which is labial, buccal, lingual, palatine. Buccal, that's in the cheek, right? Labial lips, and palatine in the palatine area. So for minor salivary gland, that's more than but I have to dig deep, guys, with the major salivary glands. And we have, of course, parotid gland, submandibular, and sublingual, as you see here. But you have to know that mostly the saliva secreted from this one, from the the submandibular gland, which represents about 70%, guys, right? And the parotid gland about 25%, and to this extent, 5% from the sublingual gland. So let us have an idea about the general structure of salivary glands in general. You know that for example, the parotid gland, covered by a capsule, right? Okay, so first of all, you have two structures. You have a connective tissue known as a stroma, and you have the functional unit inside, which is most important, known as parenchyma. So guys, as I mentioned, the stroma simply, this is, for example, any salivary gland, parotid gland, say. So the stroma represents the capsule that covers it. And from the capsule, there is a kind of connective tissue that, moves to the inside of the gland and divides it into lobes and lobules. So these connective tissue known as trabecula, right? So capsule and trabecula, and of course supported by reticular connective tissue, which is reticular cells with fibers to support these structures. So the other most important structure inside other than the stroma or connective tissue, that's mainly for support, we have the functional unit themselves, the cells there. We have secretory units, guys, and duct system. So we have cells here, right, for secretions. And of course, there's ducts. And at the end of the day, they will, the secretion will be drained outside of that salivary gland. to the oral cavity. So the secretory units, guys, so these secretory units, guys, can be serous acinus, we'll talk about it, mucus acinus, and sometimes mixed from both serous and mucus. When you say acinus, what does it mean? Acinus is a group of cells. Look at here. This one cell, another cell, another one, and so forth. So these group of cells surrounding a lumen known as acinus. So, for example, but just have an idea. This is the serous acinus. And this is mucus acinus. Serous acinus secretes, guys, the fluid, serous fluid, which is like watery fluid. But the mucus acinus, of course, secrete a kind of mucus secretion, thicker than the serous ones. And sometimes, as we mentioned, we have mixed. We have mucus acinus covered by serous acinus. And you know, this serous acinus that covers the mucus known as serous dimilium. We'll talk about it. Again, look at the cell of serous acinus. Let us take this one, which is pyramidal in shape. هلا ركز معي احكي لك الكاركترستكس للسيرس والكاركترستكس للميوكس. لما بتعرفهم تقدر تعرف شو هاي الجلاند. هي كل اللي بدي اياه منك هلا. Okay. So I think in 10-15 minutes we'll finish. So guys, look at the serous acinus, for example. At the first, the cell is pyramidal in shape. Pyramidal in shape. And look at the nucleus. It's rounded nucleus. And in the center, so it's centrally rounded nucleus. يعني النيوكليوس مش جاي عند البيزل and not on the apex or apex. So it's in the center, so centrally rounded nucleus. And look at it here. This is the centrally rounded nucleus, but you would see here there's a granules on the close to the apex. These zymogen granules has enzymes there. I think like I can't remember. I think amylase or so. Anyway, and some of them like for digestion of protein. Anyway, these shown here, guys. Look at them. These zymogen granules, and look at the acinus, the serous acinus in general. It has a small lumen, right? Compared, of course, to the mucus. Look at the mucus here, large lumen. Why we need large lumen? Because these mucus acinus secretes, guys, the mucus which is thick. Look here at the mucus cell. Look at the nucleus. It's a flat basal nucleus. Where is that? Here's it. Flat and basal nucleus. Why? Because it's squeezed by the mucus. It's close to the base. That's why it's basal flat nucleus, close to the base of the cell, squeezed by these mucus stuff you see here, right? So they squeeze the nucleus and so push it to the base and make it flat. But as I mentioned, so again, for the mucus acinus is cuboidal in shape, not exactly pyramidal, no, it's a cuboidal in general, and has a flat basal cells, has large lumen for mucus, and because of the mucus, you see what happens with the nucleus. Remember these stuff, and remember the color because of a mucus, always because of a mucus, right? It has a pale color, so the mucus during the preparation can be dissolved and or not stained, so the cell has pale foamy color زي شكل الفوم لون هيك اصفر فاتح, right? But the serous acinus, it has, it's darker in color because of hepatoxylin and eosin stain, because near the nucleus, I think it's stained with it's basophilic, and these zymogenes are acidophilic. So here is just, I'm trying to repeat what I mentioned, but there is something else I think we forgot to say, that the boundaries between the cells are not very clear and distinct. So they are indistinct boundaries in the serous acinus, but they are very clear in the between the mucus cells. So now you have an idea about the serous and mucus. Let us just give you an idea about the mixed one. So look at this example. It's a mucus acinus, but covered by serous acinus. This covered here, or this part of serous, like a cap, right? زي الطاقية يعني. This serous acinus known as serous demilion, and sometimes they call it serous crescent, and in clinically mostly they use crescent of Gayanosi, يعني الهلال تبع Gayanosi. This is the scientist who discovered it, right? So these serous demilion empties their secretion through canaliculi between these cells, between mucous cells, right, until they reach the duct. Now, I think I have to go back again here and show you one thing. Look at here, guys, again, to the serous acinus. There is a cell here outside these cells. These cells are modified epithelial cells known as myoepithelial cells, which is modified epithelial cells that has a function in contraction. That means when they contract, they squeeze the serous acinus to empty their secretion in the lumen. And they are few in number in the serous, because serous has watery secretion, but which is not shown here in the mucus acinus, there are many, guys, and I'm trying to find some, like, again, here it should be here, but not clear. Myoepithelium in the mucus, guys, myoepithelial cells in the mucus acinus, there are many. They are many compared to the serous one. So in the mucus, somebody can say why. Again, I would say because of the mucus. So always remember the mucus and remember everything related to it, including the wide lumen, flat nucleus, basal nucleus, and pale color, and the numerous number of myoepithelial cells, in which we need too many of them in the mucus, because it needs really more force and power to squeeze the mucus to the lumen. It's not like a serous. So guys, shown here, this is myoepithelial cells. Sometimes they call it basket cells because they have fibers around the acinus in order to squeeze it, as you see, making like a basket. Okay, here is this. This is important because this is our major core topic today. So we have Parotid Gland. Yes, you know that, and we have submandibular and sublingual. you have to know which one is, serous or mucus or mixed. And um, I have an easy way to remember that. Well, parotid gland from the end, it's completely, purely serous. Mainly the serous acinus there. But submandibular with us, sublingual gland as well, they are mixed, XX. So you remember, sub-mixed and sublingual also mixed. But mixed for which extent? Yes, mixed, that means serous and mucus, but the submandibular, mainly serous, with a little of some mucus and some mixed ones. But the sublingual, yes, it's mixed, but mainly mucus. It's under your tongue, remember that, and we need that much of mucus to lubricate your mouth. And in the submandibular gland, there is a numerous number of intralobular ducts compared to parotid and sublingual. You have to remember all of these things. They are very important, and especially in the theory exam. So before start talking about the glands, which is pretty easy, I would like to show you this kind of ducts. We have, guys, ducts inside the lobule itself, and we have ducts between the lobules, and we have the main ducts. And of course, we have between lobes as well. But let me start with the lobules, guys. So you have intralobular ducts. Intra, that means inside. That means inside the lobule. And there are two types. They are continuation to each other, right? You have intercalated and striated. بعد couple of slides راح تسمعني كثير احكي عنهم. Intercalated, striated. Where they are? Okay, this is a lobule. Yes. So this is the intercalated, and this is the striated. The intercalated, guys, has mainly cuboidal cells, lined by cuboidal cells. But they start to become like transitional or change into columnar in the striated. Once you go to the main ducts, lastly, the main duct, right, will be stratified squamous epithelium. يعني كل ما بيوم بتغير, right? Now, what about the interlobular duct? These between lobules, parotid gland, that's purely serous. So this is the parotid gland, purely serous. Look at the mainly serous acinus. Look at it here, which is dark color. Look at the lumen. Lumen is very small, right? The lumen of these cells like very small. Look at them here. So they are pyramidal. Each cell is pyramidal in shape. Look at the nucleus. Nucleus, centrally rounded nucleus. Centrally rounded nucleus. And look at them. They are at the end. Let us take this lobule. Look at the red line. Follow the cursor, guys. This septa, you see this septa? It divides it into a small lobule, right? So this is a lobule. And again, here is another lobule, guys. And here is another lobule, guys. So let us talk about this lobule, for example. Look at the duct here, which is like pale color, cuboidal in shape, wide lumen, mainly, I think, intralobular. But here's it's clear the intralobular excretory duct. So you know that I'm looking for intercalated and striated duct. So I think this is striated, but at the end of the day, the intercalated and the striated both are intralobular excretory duct. They are inside the lobule. You see the lobule? This is the lobule, so they are located inside the lobule. So they are intralobular excretory duct. But look at the septa here that divides the lobules, his septa. There is a kind of here, another duct inside the trabeculae, guys. Sorry. So these are interlobular. That means between these lobules, these ducts between the lobules. So they are interlobular duct, not inter, right? That means between the lobules. So again, back to our main topic, which is the salivary, the parotid gland. Look at the serous acinus, guys. They are everywhere, and they have, here we go. Here's a striated duct, and this is smaller one, which is intercalated duct, right? Let me show you also here. This is the guys, the acinus. At the nuclei. Somebody can say, yes, why it's not like here and makes like parotid? Yes, because it depends on the level of the section, right? So, but you can see here is the striated duct, which is with wide lumen. Also here, the serous acinus, guys, and here the striated duct. Like brighter and white lumen. Look at the connective tissue that separates the lobules. If there is a duct here, you will call it interlobular. Okay, that's for the parotid gland. Look at it here, guys. Parotid gland, a lot of serous. Compare now to the submandibular gland. It's mixed, but mainly serous. It will be close to the parotid. Look again, serous acinus, small lumen, centrally located nuclei in each cell, right? And look at this lobule. There is here the striated duct, pale in color, wide lumen. But yes, we mentioned the submandibular salivary gland mixed. So these, yes, there are many serous, mainly serous. But where is the mucus now? Okay, this is the mucus one. This is the mucus acinus. This is the mucus acinus. Look at the wide lumen, and they are cuboidal in shape. Look at the cell, like basal flat cell. Look at the color, which is pale in color. Again here, this is a mucus. Another mucus acinus. But there are many serous, guys. Of course, these adipose, don't look at these adipose cells. Look at these ducts, striated ducts. You can differentiate it from serous or mucus. Again, submandibular, mainly serous, but we have mucus, and we have mixed, yes, serous and mucus. And guys, look at this mucus acinus that's covered by serous, a cap, crescent of Guyanosi, or serous demilion. Look at it here. Yes, and it's clear, I would say here. Serous cover the mucus, part of the mucus like a cap, serous demilion. So, yes, because it's submandibular, it's mixed. Again here, acinus, some mucus cells shown here, mucus acinus. Look at the trabecula here. Inside it there is ducts. This is interlobular ducts, but these are intralobular. Okay, again, serous and few mucus. And mucus, I would say, I'm trying to see mucus covered by, yes, mucus covered by serous division. The last one, guys, within 5 minutes, I will finish it with the sublingual gland. Now look to the difference. Now it's male, it's mixed, yes, mixed, but mainly mucus. Look at the section. Sublingual salivary gland. Look at the section. There are a lot of mucus. Mucus acinus. Mucus acinus, guys, mainly, but with a few serous acinus like this. Serous acinus. So, what we have here also, we have, look at the intercalated duct or striated duct, and in between, here's between lobules, we have interlobular duct. I like to focus on that. Here's vessels, for example. Anyway, look at the mucus acinus, yes. Serous acinus, yes. And look at the serous demilium. But mainly, it's a mucus. It has mucus acinus. Look at it here. A lot of mucus acinus, pale in color, basal nuclei, cuboidal in shape, large lumen. I can see the lumen. But of course, we have acinus here, right? Small lumen, very small lumen. And you have the million, of course. Show you a very clear one. This one, serous demilion. Here is the demilion as well. Demilion. So also, guys, is mucus acinus. Some serous mucus as well. Look at the mucus acinus here, guys, with basal nuclei, but also it has a lot. I'm not sure this is the nuclei or the myoepithelium, but I'm sure this is the myoepithelial cells on the wall, right? Here's the myoepithelial cells. They have many myoepithelial. They have many myoepithelial cells that helps in the contraction or squeezing the content of the mucus acinus to the lumen here. Another stain shows the mucus acinus.